We're talking about your heart and what you need to know before it's too late. It's going to incorporate things like high blood pressure or hypertension, heart disease itself, coronary disease, palpitations, and when it's scary. But more or less, it's just going to be just a little bit of everything, or anything. So if you have any questions, just let me know in the comments, and we'll try to get it answered as much as possible. The bigger question is, why is this important, or why is heart disease important? I think we all know by now that heart disease or coronary disease is the heart disease itself is the leading cause of death in the United States. So the more that we know about this and we are able to fight it, we can hopefully prevent something drastic from happening. That drastic thing can be as, simple as high blood pressure, um, but it can also lead to things like heart attacks. So it's always important for us to understand what these um, risk factors are, and how we can prevent a heart attack. So things like high blood pressure or hypertension, heart hyperlipidemia or high cholesterol, diabetes itself, all of these play a huge impact. Smoking. Um, I truly believe that prevention is going to be one of the best things that we can do. And unfortunately, a lot of people have these symptoms and aren't seen quickly enough, and it typically leads to something bad happening, and that something can be a heart attack or a stroke. So if we do our best to treat it early on, we can hope that we will prevent this from happening. So, you know, it's simple, but it's also difficult, because it's easy to say, these are the symptoms, fix this, and your life is going to be better. But the reality is, these things are difficult. Controlling blood pressure is difficult. Controlling weight for some people is difficult. Life is difficult. You can't tell someone to get 8 hours of sleep when they are sometimes working several jobs to make ends meet. But if we understand the big picture, that it's not just one thing that can lead to it. For certain people, it's a constellation of high blood pressure, diabetes, stress, not seeing your primary care, not being treated for underlying risk factors. Those can all play a huge factor where someone ends up having a heart attack in the future. So I want to know, what troubles do you guys have when it comes to your health, when it comes to understanding your heart, when it comes to understanding, what to look out for. For everyone who's just coming in, is Dr. Isang, using this platform to discuss your heart health and prevention, and just answering questions when it comes to your heart and your health. Charlotte, welcome, and I hope you're doing well. Let me know where you guys are coming in from. Give it about a minute to try to answer any questions that someone may have in the comments. But while those questions are being asked, it's extremely important that we look at this carefully, look at this closely, and just continue to just talk about it more frequently. It's still very common for someone to come into the hospital and get diagnosed with high blood pressure for the first time. Why? Because they were also diagnosed with a stroke or with a heart attack. So if we understand that this blood pressure, though, is just a number, it can play a huge factor in our lives. High blood pressure is not just going to affect it today or tomorrow, but it's chronic, untreated high blood pressure for decades, multiple decades. Sometimes people have symptoms ongoing for 20 plus years, and then they finally go to the hospital and they're diagnosed with a heart attack or with heart failure. Our goal is to hopefully prevent that from happening. Our goal is to prevent you from going in and being diagnosed with all those things, with high blood pressure, and not knowing that that could have been treated a long time, and hopefully preventing or delaying the diagnosis that you got. So in addition to high blood pressure, we have to take into effect things like high cholesterol, like I previously said, diabetes. Diabetes plays a huge factor, in with diabetes, things like insulin resistance, and the downstream effects that it can affect, and how it can affect the coronaries. So the multiple times your body is being exposed to excess amounts of insulin can lead to plaque build up on the arteries, which can lead to a heart attack from happening. Thank you for the comments about the glasses. These are Ray-Bans. But what questions do you guys have regarding your heart, regarding your health, regarding anything in that realm that I can be of assistance for? Word. All right. So when it comes to things like high blood pressure, so in the first place, what is high blood pressure? What is considered high blood pressure? All the guidelines typically want the blood pressure to be around 120 over 80, and the biggest reason behind that is there's been trials that have shown that even blood pressures in the 130s or above can lead to many strokes in individuals, such as the SPRINT trial. But high blood pressure can be looked at as when you look at things like pre-hypertension, it is a top number that is greater than 120 to 129, stage 1 greater than 130, and stage 2 greater than 140. So depending on what stage you are at, especially if it is pre-hypertension or stage 1, I want to stress the importance of lifestyle changes. So with weight loss, with exercising routinely, with stress management, with nutrition. Nutrition is probably going to be one of the biggest ones, especially processed foods and excess salt. The biggest diet that a lot of physicians and cardiologists specifically recommend is either the DASH diet or the Mediterranean diet, which you can look up. They're about the same. One kind of focuses more on limiting the amount of salts that you take in, because that directly can affect the blood pressure. So the DASH diet is really good to help bring down that blood pressure, which also, once again, focuses on decreasing the amounts of processed foods, red meats, increasing fruits, vegetables, fish, and things like that. So exercising consistently, when you exercise once, that may not bring your blood pressure down significantly, but if you do it consistently for a long time, then you're gonna see those benefits, those cardiac benefits too. It's one of the reasons why you see a lot of cyclists, people, bicyclists, and people who do marathons have really low heart rates and sometimes even low blood pressures, because their body, their heart has been kind of formed in a way to work efficiently at a lower heart rate and just get the best out of it. So exercising is going to be one of the biggest things, in addition to nutrition, that you can do for your health and your heart overall. But if we see that we've given you about 3 to 6 weeks and your blood pressure has not changed and it's still in the high 130s, 140s, then we have to look at medications, because we don't want it to stay that long for too long, because it can lead to stroke, heart attacks, heart failure, and things like dementia. So, and there's a lot of different medications: calcium channel blockers, aldosterone receptor blockers, ACE inhibitors, thiazide. They all work well. The biggest thing that leads to choosing one or the other is the side effects. Some of them can cause ankle swelling. Some of them can cause elevated potassiums. So if you do already have those things, you don't want to add something that can potentially lead to the blood pressure being a little bit elevated, to lead to those side effects being more pronounced. It says, tell a joke, tell a dirty joke. It's not the right channel for you, my lady. I think you need to find a different one. But if you want to know about your heart, boom, I got you with that. But there are other lives that are going on that can help satisfy your needs with dirty jokes. For the people who are logging in, this is Dr. Isang using this platform to, talk about the heart health and prevention. So we've talked about why blood pressure is important, and the ways to treat it, both naturally and also with medications. So in addition, stepping aside from blood pressure, we'll talk about chest pain because that's the most common reason why someone comes and sees me. So, chest pain, pain here, pain that radiates to the shoulder, left shoulder, and pain that gets worse whenever you're exerting yourself, pain that gets worse with stress. Those are all concerning. Pain that gets better with rest or medication called nitroglycerin. Those are all concerning. So if you have any of those, you really want to be seen by your medical provider as soon as possible because it could be nothing, but it also could be impending heart disease. And when you do see them, if their symptoms are getting, turn up, Germany's in the building. If the symptoms are getting really, really bad, you may need to be seen in the emergency department. Sometimes the urgent care may be helpful, but a lot of times I've found that people who go to the urgent care end up being referred to the emergency department. So that may be the best place to go, just depending on the acuity or how fast it's happening. What is good to take naturally? Things like, well, for your blood pressure, if you have low magnesium, if you have low potassium, that's going to be good to take. Things like beets can dilate the arteries a little bit. That can lead to lower blood pressures, increasing blood flow. Um, Green vegetables also are available, and things that have antioxidants in it can be beneficial too. Opinions on psychedelic assisted therapy. I got no opinions on that one. Unfortunately, I wish I could help, but I can't give you opinions on something that I'm not well versed in. Um, but yeah, if you're having all of those chest pains and they're very concerning, going to the ER is going to be one of the biggest things that you can do. In the ER, continue with that workup, continue with those questions, such as, how long has this chest pain been going on for? To get some labs. If the labs are abnormal, then we may have to proceed with either a stress test or a cardiac catheterization. Stress test if the pain has finally resolved, cardiac catheterization if the pain is persistent. If the Sometimes we can also get an echocardiogram, which is an ultrasound of the heart. If this is abnormal, once again, we would pursue um, cardiac catheterization, and this is an invasive procedure that looks at blockages in the heart arteries. If there are significant blockages, we would open it up with a stent. If there are blockages in scary locations or several blockages, then we have to look at open heart surgery. This is also termed coronary artery bypass graft or CABG, CABG. So a lot of times people come in and everything is normal. The stress test is normal, the echo is normal. Sometimes they even get a cardiac catheterization and it is also normal. So what do we do next? Then it's our job to look at non-cardiac causes. So things like the gallbladder, the pancreas, reflux. Those can all cause symptoms that are similar to someone having heart issues. It can all cause chest pains. And it can all cause chest pains. So ketamine caught me off guard, but yeah, used it a long time ago when entering my internal medicine rotations, but I'm not well versed in it. And I have seen some of my patients actually are seen by psychologists, psychiatrists, and are using that to help with their needs. In the emergency department, we utilize these testings, these procedures to rule out life-threatening, life-altering conditions. So if those have been ruled out, the next steps is going to be to work on further evaluations on an outpatient basis. So Like I said, we'll look for something like pancreatitis, cholecystitis. And by we, it's usually the primary medical provider because as cardiologists, our job is to make sure that your discomfort is not due to a cardiac event. If it's not due to a cardiac event, we send back to the referring physician to continue workup, continue the management of their discomfort. I've found two things. If everything is normal, we have to look at any type of psychosocial stressors that are causing this. But we also have to look at things like, we have to also look at things like sleep apnea. I find that a lot of my patients who have ongoing issues with chest pains and if they snore, I finally do this workup, and this workup is typically negative for heart disease, but I do this workup for sleep apnea, and a lot of times they get diagnosed with sleep apnea, and once it is treated, their symptoms become a lot better. But I also want to mention, like I said, the psychosocial aspects of it, that a lot of times after all of these things have been ruled out and um, we look to see if there's any stressors that can be causing the discomfort that they're having. I do find that sometimes with weight management, a lot of those symptoms also gets better. Adita, I hope you're doing well. I did not say that right. Sharma, I hope you're doing well. I've been taking potassium pills as well, as it seems to have brought the blood pressure on that. There's actually a pathophysiology reason as to that. If you have low potassiums, there's a reaction in the body that actually has your body to hold on to more salt, and by holding on to more salt, leads to high blood pressure. So if you treat that with controlling the blood pressure, increasing the potassium consumption, I find that a lot of people's blood pressures are treated very, very well. This is Dr. Isang using this platform to discuss your heart health and prevention. Hope you guys have a good night, and I'll be back on later in the tomorrow probably to help answer any questions you guys may have.